So I imagine we all have an idea of pain. So if you've had a muscle pull, or maybe childbirth, menstrual cramps. Now, imagine having a pain with an intensity that is probably 50 times worse. Terrible, isn't it? This gives you an idea of what people living with sickle cell disease have to deal with on a regular basis. And the worst part, sickle cell disease currently has no cure, at least not one that is available to the vast majority of people who suffer from this disease, more than half of which are found in Western Africa. And so, this inspires the question, is it possible to reduce the frequency of occurrences of painful episodes in sickle cell disease? I think I have an idea. And the answer is yes, because we've seen in chronic conditions like diabetes, that by empowering patients with specific knowledge around the disease, the patients are better able to manage the symptoms, reduce deterioration, or occurrence of complications. But then there is a problem, which is sickle cell is not extensively studied. At least most of the studies you find in literature are done in the context of the West, in the US or in Europe, even though most of the cases of sickle cell disease are in West Africa. The second point is, if we can reduce the frequency of occurrences by empowering these patients with specific knowledge, we need to identify what knowledge deficits are linked to the occurrence of these episodes. And so maybe the more important question will be, are knowledge deficits linked to the occurrence of painful episodes in sickle cell disease? This question is what I intend to answer with my doctoral research, which is focused on evaluating the knowledge deficits that are present in parents of children aged 0 to 5, as well as adolescents and young adults living with sickle cell disease. Unfortunately, I wouldn't be able to tell you just in 3 minutes if my idea would work. But hopefully in the next 3 years, I might have some answers. So as a recap, it is possible, it may be possible rather, to reduce the frequency of occurrences by empowering these patients with specific knowledge. But in order to do that, we need to identify if actually there are knowledge deficits that are present in these patients, but more specifically, if these knowledge deficits are linked to the occurrence of painful episodes in sickle cell. Thank you.